Alrighty, this is part 3 of focus review number 4, the final for Nursing 240. The stroke patient and blood pressure. Use of drugs to lower blood pressure is only recommended if the mean arterial pressure is above 130, or the systolic pressure is above 220. Remember, to figure the mean arterial pressure, you add the systolic blood pressure plus the diastolic blood pressure plus the diastolic blood pressure again and divide it by 3, and that'll give you your mean arterial pressure. Stroke risk factor, which one is the most important? That would be blood pressure. TIAs, transient ischemic attacks. A transient ischemic attack is a transient episode of neurologic dysfunction caused by focal brain, spinal cord, or retinal ischemia, but without acute infarction of the brain. Symptoms typically last less than 1 hour. Encourage these people to go to the emergency room. The TIAs may be due to microemboli that temporarily block the blood flow. TIAs are a warning sign of progressive cerebrovascular disease. Some symptoms: temporary loss of vision, transient hemiparesis, numbness or loss of sensation, sudden inability to speak, tinnitus, or blurred vision. A tonopen. A tonopen is used to measure interocular pressure. Tuning forks, the Rhine and the Weber test. The Rhine test is a tuning fork. It's struck. The examiner holds the base of the tuning fork against the mastoid bone. You're looking for bone conduction when you hold it against the mastoid bone. When the sound is no longer heard, the vibrating tuning fork that is still vibrating is placed in front of the ear canal. Normally, the sound will be heard twice as long in front of the ear as on the bone. If the patient hears the tuning fork better by bone conduction, the test is negative, which suggests a conduction hearing loss. The Weber test, an activating tuning fork is placed on the midline of the skull. If the patient has conductive hearing loss, the sound will be heard better in that ear. If sensorial hearing loss, the sound is louder in the unaffected ear. Tympanoplasty care of the patient. This is reconstruction of the tympanic membrane. They want to avoid sudden movement, get out of bed slowly to avoid dizziness. They can't get their head wet until the surgeon says that this is okay. Report fever, pain, increase in hearing loss, or drainage from the ear. Don't blow your nose or cough. If you must, you got to leave your mouth open. Avoid crowds with respiratory infections. Avoid areas where your ears will pop. Urination. If your patient hasn't urinated within 8 hours, do a bladder scan first and then cath them if need be. Vestibular disease. Vestibular patients, that pertains to your balance. Remember, dizziness is a sensation of being off balance that occurs when you're standing or walking. It does not occur when you're lying down. Vertigo, however, is a sense that the person or objects around the room are moving or spinning, and is usually stimulated by movement of the head. So with vertigo, that person feels like everything else is spinning around them. The rotary chair testing is done. The patient is seated in a chair driven by a motor under computer control. Test is done in the dark. You want to instruct these patients to eat light meal before the test to avoid nausea. Observe the patient for vomiting. Ensure the patient's safety. Caffeine, stimulants, sedatives, and anti-vertigo drugs cannot be used prior to the test. Warfarin. It will be prescribed if the patient has experienced a TIA with an atrial fib. So if somebody comes into the emergency room and they got cranial hemorrhaging, you want to double check, and they tell you they've had atrial fib. You probably need to find out if they're taking Coumadin because of that atrial fib. This is something that Melissa gave me to try to help remember the nerves. See if I can put it and make it make sense to me. You have one nose, that's the olfactory. You have two eyes, that's the optic nerves. 3, 4, and 6 make your eyes do tricks. That's the ocular, the trochlear, and the abducens. So you have one nose, olfactory. You have 2 eyes. So number 2 is the optic. 3, 4, and 6 make your eyes do tricks. That's the ocular motor, the trochlear, and the abducens. 5 rhymes with 5. Rhymes with trigeminal. Okay, that's a stretch, but I got it. 5 rhymes with trigeminal. The number 7 can be drawn on your face, facial. Okay, not quite following that one, but I'll have them show me. You can make an 8 in your ear. 8 is the acoustic. 9 and 10 both have a G, glossopharyngeal in vagus. I like that. 11 makes your shoulders go to heaven, spinal accessory. And 12 is the hypoglossal. So you have one nose, that's the olfactory. You have 2 eyes, that's the optic. 3, 4, and 6 make your eyes do tricks. That's the ocular motor, the trochlear, and the abducens. Number 5 is the trigeminal nerve, if I remember. 5 rhymes with tri. Number 7 you can draw on your face. That's the facial. Number 8 you can make an 8 in your ear. Number 9 and 10, they both have G in their answer. Glossopharyngeal and vagus. And 11 makes your shoulders go to heaven, and 12 is hypoglossal. I think I got that. And the rest of these notes are the math formulas. I'll go ahead and go through it, I guess, but you know, hopefully that helps somebody. But if not, I tried to help. The formula I use is desired over have, H-A-V-E, times the quantity equals the dose you're going to give. This can be verbally stated as desired order from the doctor divided by what you have on hand multiplied by the quantity that the medication comes in. So D in the equation, D equals the order from the physician. H is the dosage you have on hand, such as a 100 milligram tablet, and quantity. Q equals quantity. The dosage, such as 100 milligram per 5 milliliter. So in that particular statement, the quantity would be the 5 milliliter. The 100 milligram is still the dosage, but the quantity is the 5 milliliter. So with that in mind, the order is for 10 milligrams of Tylenol per kilogram once a day. Well, you got to find out how much the patient weighs, 176 pounds. Divide that by 2.2. So now you've got 80 kilograms. So you know that you want to have 80 kilograms multiplied by the order that came from the doctor of 10 milligrams per kilogram. So the doctor wants this guy to have 800 milligrams per day based on his weight in kilograms. You have in your hand a bottle of Tylenol that's labeled 200 milligrams per 5 milliliters. Now remember, the doctor wants this guy to get 800 milligrams a day. So your desired, look at the formula. The desired is the 800 milligrams daily divided by the 200 milligrams that you have on hand. The trick here is when you are dividing, you always want to remember to cross out the common part of the numerator and the denominator. In this case, that common thing is milligrams. So if you took 800 milligrams divided by 200 milligrams, you cross out the milligrams because 800 milligram is on top, 800 divided by 200. So you cross out the milligrams, and that just leaves you 800 divided by 200. And of course, that is 4. Then the rest of the equation is you take the 4, multiply that times the quantity, which is 5 milliliters. That's all you have left is 5 milliliters. So 4 times 5 is 20. And since milliliters is the only thing you have left, you know that you're going to give the guy 20 milliliters. That's how you figure out what it is you're giving them: milligrams, milliliters, whatever. So that's what you're going to give them in. You're going to give them 20 milliliters. Example number 2. Sorry about that. Example number 2. I'm about to sneeze all over. Oh, goodness. Sorry. Example number 2. Try not to sneeze. Order is for 50 micrograms of aspirin per day. Per kilogram. I'm sorry. The order is for 50 micrograms of aspirin per kilogram twice a day. Patient weighs 105.6 pounds. So you're going to take the 105.6 and you're going to divide it by 2.2, which is going to end up with 48 kilograms. Now, so the doctor wants him to get 50 micrograms per kilogram. So next you take the 50 micrograms times the 48 kilograms, and it turns into 2,400 micrograms twice a day. You have on hand aspirin 8 milligrams per 2 milliliters. So that now it seems like it's trying to get tricky, but it's not. You just need to use your equation. The desired is 2,400 micrograms twice a day. You divide that by the 8 milligrams, but before doing that, you know that you gotta make everything the same. So you must convert the 2,400 micrograms to milligrams, and that's a very simple thing to do. If you look at 2,400 milligrams, if you wrote that on a piece of paper, you could write it down as 2400.0. Obviously, in medical math, we don't normally write down the 0.0 afterwards because you could screw up medical orders. But that's how it would look like on a piece of paper. So if you did that and you moved your decimal point 3 places to the left, you now would have a 2.400. And we know we can't have those trailing zeros. So you knock off the 2 zeros and you have just 2.4 milligrams. That's what the doctor wants this guy to get twice a day. See, the equation is coming into play here. It's going to be very simple. Now do your equation, desired over have, multiplied by quantity. The desired, that's what we just figured out. The desired was 2.4 milligrams. That's the order from the doctor, divided by the 8 milligrams that you have. And remember, to cross off, 2.4 divided by 2.4 milligrams divided by 8 milligrams equals 0.3. Remember to cross off the mg's, the milligrams, in your equation, since they are common in the numerator and the denominator. So you're left with 0.3. Now you're down to the final step. Finally, 0.3. This number really doesn't have any meaning to you yet, other than it's a number until you multiply it by the quantity. So 0.3 multiplied by 2 milliliters equals 0.6 milliliters. This is the dose you will give. The way you know what to assign to the 0.3 is milliliters is the only thing that is not a number in the last part of your equation. 0.3 times 2 milliliters equals 0.6 milliliters. Hopefully that's making some sense to you. And finally, I put in there Celsius to Fahrenheit and Fahrenheit to Celsius. Remember, MA is going to South Dakota, SD. Just if you can keep that in your mind, you'll always get this. MA is going to South Dakota. MA, MA stands for multiply and add. South Dakota stands for subtract and divide. And the numbers that you multiply and add or subtract and divide are always going to be 32 and 1.8. So the Celsius temperature outside is 18 degrees. You know, if you think through it, that the Celsius temperature is, when you look at it, if it says it's, I'm just going to make this up, if it says it's 20 degrees Celsius outside, you know that it's probably about 60 degrees Fahrenheit. So that 60 is always going to be a bigger number. So going from Celsius to Fahrenheit, you're going to have a bigger number. in the end. So in order to get a bigger number, you're going to multiply and add something. You're not going to subtract and divide, because that number would get smaller. So from Celsius to Fahrenheit, the Celsius temperature is 18. 18 multiplied by 1.8, then add 32. You can't get it. You can't do it backwards. You can't take 18 and multiply it by 32 and add 1.8. It's got to be multiplied by 1.8 and then add 32. And then Fahrenheit to Celsius, you want to get from a bigger number to a smaller number. So if the temperature outside is 64.4, subtract and divide. 64 minus 32 divided by 1.8. Just remember Ma in South Dakota, and that 32, which is the freezing point, if you remember that. 32 is the freezing point of water, and then the multiplier or the divider is 1.8. And finally, I think I put on here, always remember when working with drip rates to start with the premise that you are giving the medication over 1 hour, 60 minutes. Start with that as your kind of base. So if the time frame becomes 15 minutes, then it's going to be running 4 times faster than if it was going to infuse over an hour. If I'm going to give you 100 milliliters of water, let's not even put it in a needle. Let's say that I tell you in the next hour I want you to drink 100 milliliters of water. No, that's a bad example. I'm sorry. In the next hour I'm going to give you 100 milliliters of fluid intravenously, and it's going to take an hour to do it. 100 milliliters. Okay, that's pretty simple. Now I'm going to take that same 100 milliliters and I'm going to give that same 100 milliliters to you in 15 minutes. That is 1/4 of an hour. So you just take the 100 milliliters an hour, and if I'm going to give you 100 milliliters in 15 minutes, that's the equivalent of, now remember, that's the equivalent of 400 milliliters an hour. So if you always start off with per hour as your basis, you can normally figure it out. Because tubing on IV tubing and so forth, it's based on a per hour flow, the drip rate, or per milliliter. I'm sorry, per milliliter, not per hour. But that's how I keep things straight in my mind. I go off of a 1 hour. If they're gonna give 100 milliliters in an hour, and then the next day they're going to give 100 milliliters in 2 hours, well, that's pretty simple. You know that it's 100 milliliters in 2 hours, but how much is that in an hour? Well, that's 50. It took twice as long to do it. So if it takes twice as long to do it, you divide. If it takes half as long to do it, you multiply. Twice as long to do it, you divide. So 100 divided by twice as long is 50. 100 divided by 2 is 50. Half as long to do it, you multiply. 100 times 2 is 200. So hopefully that helps and I'm not confusing you more. Alrighty, that's it. Good luck.